Hi everyone, I'm Michelle Coombs. I'm a physical therapist, and today we're going to be doing an overview on vestibular rehabilitation therapy, or VRT. Like visual rehabilitation, VRT is a very specialized type of therapy. It's used to treat those who have symptoms from vestibular disorders, usually involving the inner ear, and people tend to complain of dizziness or vertigo symptoms that can be quite debilitating. It's important to remember that the vestibular system is highly interconnected with our visual system. They complement each other, and when they're working together well, it allows us to control our posture, stabilize our gaze, as well as differentiate self-movement from external movement, so whether we're moving or our environment is moving. Now, what do people mean when they say, "I feel dizzy"? People say that all the time, but we need to dig deeper because many people feel different things, but they just say that they're dizzy. Do they feel lightheaded? If they feel lightheaded or faint, it could be related to their blood pressure. If they are having an orthostatic hypotension episode, when they change positions, some people will experience a big drop in their blood pressure and feel lightheaded. If they feel spinning, you can ask them what direction is it spinning. They can usually tell you with their finger. Some people will experience feeling like objects in their visual field are jiggling or vibrating when they know that they're in fact not moving. This is called oscillopsia. And these are just a few things that they might be meaning when they just say, "I'm dizzy." So it's good for us to get a clearer picture of their symptoms. Now, who would benefit from vestibular rehabilitation? Those who have gaze stability issues, so people who have trouble maintaining a clear image or vision while their head is moving. People who have motion sensitivity, so whether it's from moving of their eyes or their head or bending down, there are different positions. Some people get very sensitive to those positions, and some people have a condition called benign paroxysmal positional vertigo, or BPPV. This is a condition where the otoliths that are in one part of your inner ear, these are small crystals, they somehow get dislodged into a different part of the inner ear, the semicircular canals. When they are dislodged and free-floating in these canals, it does give our brain the false impression of movement, which then gives people the vertigo symptoms. Lastly, other people who would benefit from VRT are people who have balance issues. They may not have the three things that we listed above, but for some reason they just feel off balance. Now let's go over the treatment exercises for these different categories. If you have gaze stability issues, we're going to give them gaze stability exercises. If they have motion sensitivity issues, we're going to give them habituation exercises, which is basically gradual exposure to positions that cause them symptoms. And over time, the brain starts to adapt and will decrease that dizziness response. For BPPV, we would do canalith repositioning maneuvers. There are different types, there are different canals. We're not going to go into all those details today, but just know that there's more than one repositioning maneuver. And lastly, for people who have balance issues, we will follow up with strength, gait, and balance training. It's important to differentiate if the vestibular symptoms are from central or peripheral origin. So central normally refers to the central nervous system, meaning the brain and spinal cord. For VRT, that's going to include the cerebellum, the brainstem, and any other central structures that are involved in the vestibular system. So central conditions could be stroke, multiple sclerosis, traumatic brain injury, brain tumor, etc. For peripheral origin, peripheral meaning usually related to the peripheral nervous system. That's usually meaning spinal nerves, peripheral body structures outside of the brain and spinal cord. For VRT, this usually means the vestibular nerve. The vestibular nerve is a branch off of cranial nerve 8, which is the vestibulocochlear nerve. It's a branch that goes to the vestibular apparatus, whereas the cochlear branch is going to go to the cochlea, which is responsible for helping us hear. Another structure for VRT that's peripheral is our inner ear. So the inner ear is made up of semicircular canals as well as the otolith organs. Conditions that are of peripheral origin include BPPV, vestibular neuritis, or inflammation of the vestibular nerve, Meniere's disease. Certain medications, such as gentamicin, they can actually damage the hair cells within the inner ear or even damage the nerve connection between the brain and the ear, as well as inner ear infections, etc. Now, let's also talk about how to differentiate central peripheral using onset of symptoms, the symptoms themselves, as well as the treatment. For central conditions, it's usually a gradual onset, but it could be sudden, and this may fluctuate. The symptoms themselves are vertigo, although it's usually less intense than what is experienced with peripheral origin, imbalance, incoordination, and nystagmus. Nystagmus is rapid involuntary eye movements. We're not going to get too much into it, but they can go different directions depending on if it's central or peripheral. VRT is still beneficial, but outcomes are less favorable than using VRT for peripheral disorders, often because it's just complex. If it's of a central origin, there's usually a neurological condition or event. So potentially we're also dealing with hemiparesis, which means weakness on half of their body, impaired sensation, and other neurological symptoms. So they do need treatment and management of that central condition as well. For vestibular disorders that are of a peripheral origin, the onset is usually sudden and very intense. The symptoms also include vertigo, but as we mentioned, it's more intense than the central version. There's often nausea and vomiting. There's also imbalance and nystagmus. They may also have tinnitus, which means ringing in the ears, or hearing loss. In the acute phase, they're often given meclizine or some other vestibular suppressant just to calm down the nausea, hopefully decrease the amount of times they vomit so they can participate in their therapy. Peripheral usually responds well to VRT, but some conditions, they tend to recur and they may need to undergo another round of VRT. So I think it's about 50% of people who have one episode of VPPV are going to have another one in a few years. Now, VRT is going to be unique to each person's impairments, and we want to increase the challenge as they progress. So it's important to find a healthcare provider who is trained in VRT. VRT usually takes about 6 to 8 weeks, 1 to 2 times a week, so 1 to 2 sessions a week. You may start to notice improvement by 2 to 4 weeks, but some people do need up to 12 weeks for maximum benefit. I'm going to make additional videos that focus on the 4 categories: gaze stability issues, motion sensitivity, BPPV, and imbalance. Lastly, VRT has been shown to be safe and effective. It helps people reduce dizziness, improve their balance, their participation, and their quality of life. All right, that's all for today's video. I hope you enjoyed it. If you did, give it a like and subscribe.